Hello, my name is Autumn and I will be presenting on Clostridium difficile. So what is Clostridium difficile, also known as C. diff? It is a gram-positive bacteria that is rod-shaped. It is commonly found in the environment, including our soil, air, and water. It is also found in the human intestines and human feces. And pretty much this microbe causes a highly contagious infection leading to diarrhea and colitis. Risk factors of being infected with this microbe include antibiotic use, being in the healthcare setting, especially places like hospitals. Another risk factor is age. Individuals who are older tend to be more susceptible to C. diff infections. And then one last risk factor is being immunocompromised. So Clostridium difficile is transmitted via the fecal-oral route. And what this means is that feces containing the bacteria either get on our food or are on a surface, and we consume the food, or we make contact with the surface and then eat with our hands or touch our mouths, and that is how the bacteria is introduced into our system. And pretty much when this bacteria overgrows, it produces a toxin that is damaging to the colon. And what causes the overgrowth of the Clostridium difficile is typically antibiotic use. Once we use antibiotics, it kills off a lot of the bacteria in our gut. This leads to less competition and makes it more easier for the C. diff bacteria to overgrow. Symptoms of C. diff infection include abdominal pain and cramping, diarrhea, fever, fatigue, nausea and vomiting, loss of appetite, and then in more extreme cases, we can see swollen abdomen and rapid heart rate. So there are a few different ways we can diagnose this bacteria. The first thing we look for is presence of diarrhea and other C. diff symptoms. We can also obtain a stool sample, and what we'll do with that sample is test for the presence of the toxin that is produced by the C. diff, or we will culture the C. diff from that fecal sample. And then one other way we can kind of diagnose this infection is by doing a colonoscopy. And then there are a few different treatments for a C. diff infection. The main treatment is by antibiotics, which is kind of ironic, but the main two antibiotics we use is vancomycin and metronidazole. A different type of treatment would be a fecal transplant. This is typically done by someone close to you that you live with or a significant other. And the goal of this treatment is to restore bacterial balance in the intestine. And then one last example of a treatment for this infection, which is typically in more extreme cases, would be surgery, which involves removing the diseased part of the colon. These are my references, and that is all. Thank you for listening.